Good morning. I'm Dr. Lukens. This is Toto. Toto is a diabetic Cairn Terrier. We diagnosed him with diabetes on October 19th, 2009. And Toto was presented to us with typical signs of diabetes: drinking a lot, urinating a lot, wanting to eat, losing weight. And a blood test showed that his blood sugar was 498. Normal in a dog is about 90 to 110, so he was about 4 or 5 times higher than it should be. And based on his weight at the time, we started him on 4 units of insulin twice a day. And most of you, I think your veterinarians will be prescribing that type of regimen, 4 twice a day. And it's important sometime after starting them on insulin to check their blood sugars. So the owners brought him back in. It was the 19th of October when he was diagnosed. They brought him in the 13th of November. We tested his blood sugar. It was 381. And which means that it was nowhere near as low as it should have been. But at that day, Toto had just come from the boarding kennel, and so we thought maybe the stress of that has raised his blood sugar. So we waited 3 days and checked him again, and his blood sugar had gone all the way down to 371. So we upped his dose to 6 units at that time. So instead of getting 4, he's getting 6 twice a day, every 12 hours. And we also introduced at that time Dia-Treaties. Now, of course, this is a Dia-Treaties website, so we got to get a little dig for them. Well, we started him on Dia-Treaties, getting 1 treat after each injection. And the owners brought him back 4 days later, and his blood sugar was 61. And so Toto has become, for us, kind of a poster boy for Dia-Treaties, because this was early in the development of the treat, and Toto was really a success story for us. So we were happy. So now what I want to do here in a minute, I'm going to demonstrate how to give an injection of insulin. It's an interesting thing. Veterinarians, of course, use needles many times a day, and it's very common for us to stick a needle into a critter. But to ask people to do it and stick it in their beloved pets, that's sometimes kind of difficult. So I'm going to get set up here, and then I'll show you how we're going to do it. Okay? Be right back. As you can see, this is a U100 insulin syringe, and I believe most of you will be using insulin that is U100. That means there are 100 units of insulin per cc of fluid. So it's extremely important. There is 40 unit insulin out there, and so that you have the proper syringes for the strength of insulin. So to open it, you just separate the plastic. And there's the syringe. Now, one other thing about this. If you look, this needle, if we can get a close-up of that, is a 1/2 inch long. And that's kind of important in a dog, because you want to make absolutely sure that the insulin gets under the skin, not in the skin. And I'll show you how to give the shot. So for our purposes, we'll pretend that this is a bottle of insulin. This should be kept in the refrigerator. And when you take it out, you will see settled in the bottom a kind of a white powder. And that needs to be mixed in. Now with insulin, you never shake the vial to suspend the insulin. You roll it back and forth in your hands kind of gently, or roll it between your palms, but don't. Toto is on 10 units of insulin. There's the 10, and you can see it's very well marked. So the first order of business is you draw up 10 units of air into the syringe. Then you take the cap off, take the bottle and hold it upside down and put the needle in the little bullseye in the rubber. Then you inject the air because you're going to draw out an equal volume of liquid. So you inject the volume of air so it keeps you from getting a vacuum in this bottle. And then you draw this down to the 10 and then kind of, you see this on TV and in those horror movies, they flick the syringe with their fingers to make sure there's no air bubbles in here, which would mess up your dosage. And you have that. You've got 10 units of insulin in there now, and you put the cap back on. And we're ready to inject. Of course, I cheat here at the clinic because I have an assistant to hold the dogs for me whenever I do anything. But for your purposes at home, I'll show you how to do this. Now here's the insulin. I have a habit of pulling the cap off the needle in my teeth. So you want to give the shot right up in the back of the neck. These are the shoulder blades. You kind of want to go right between it. And I kind of pinch the skin there, okay? And then I take the cap off and you got a little tent, and then I just stick the needle in and inject. And you saw how he jumped. He didn't even know that he got a shot. So I'll just do it again. And you kind of come off the midline just a little bit, but I pinch, move my thumb, and stick it in. Now, you don't want to baby the needle in. You want to kind of make it, watch again, kind of a quick stab, okay? Don't get your thumb. Kind of a quick stab, and then inject your insulin, making sure it's under the skin.